Hello and welcome to this edition of EC3 HOSA Medical Moments. It's fall, the leaves are changing, my voice is changing. So it's a time of a lot of seasonal issues. So joining me today is Melissa Phillips, and she's with the Lincoln Trail District Health Department. And first, Melissa, kind of tell where you serve, and so individuals that may not be as aware of Lincoln Trail, some of the services and where you're located.
So our district covers 6 counties. That's Hardin, LaRue, Marion, Meade, Nelson, and Washington. I always have to do them in ABC order. We also have an administrative office here in Elizabethtown, which is where my office is located. I handle public relations for the health department. Our services are kind of divided into 3 categories. We have our clinical services like pregnancy testing and STD testing and vaccination. We have our outreach services, which is our early childhood programs, our harm reduction programs, and then we have our environmental branch. And most people think of them as the food inspectors, but they do so much more than that.
Right. We've got a number of things that we want to discuss today in regards to vaccines and age levels and things such as that. So let's go ahead and jump into vaccines.
So I think a lot of people think of this time of year as flu season. But with new viruses like COVID-19, it's actually been renamed respiratory virus season.
Okay.
So just some new terminology. If you hear that, that's what we're talking about. So I thought it would be a good idea to come in, talk about some of the viruses that are out there this time of year, talk about vaccination, who should get vaccinated, why you should get vaccinated, and that sort of thing.
Okay.
So I thought we'd talk about COVID-19 first. Mm-hmm. Yes, we're not in a pandemic anymore, but it's still out there, still mutating, doing what viruses do. So the recommendation from CDC for COVID vaccination is anybody 6 months and up. And especially if you are at severe risk for disease, if you've never had a COVID vaccine, or you're 65 years or older, you're especially recommended to get that vaccine. So like any other vaccine, it really just protects from severe illness and death. It doesn't necessarily mean you won't ever be exposed to the virus, but you should have a much easier time if you were exposed to the virus, if you've been vaccinated.
Can I ask a question about the dosage? You know, in the beginning you had to have, if you had Moderna, you should stay with Moderna, or if you had this one, you should stay with that. Is that still the case, that if your original vaccine and your boosters were one brand, do you continue with that brand, or is it more generic?
So there are 3, and they're mRNA vaccines that are approved, and actually there is a new 2024-2025 version of those vaccines. So you don't necessarily have to stick to a manufacturer. That's your preference. Most people do. Mm-hmm. But you definitely want to, if you're eligible for a booster, look at that new vaccine, the most updated, because it is going to be most effective against the strains that are circulating right now. Right. And just, you know, if you've been one of those folks who've kept up to date with your COVID boosters, protection does wane over time. So, you know, talk to your doctor. You can talk to the health department to see if you are eligible for one of those new updated boosters. And then flu. You know, everybody knows about flu season. Right. The recommendation is similar. Anybody 6 months and up to get that flu vaccine. Special recommendation if you're 65 or older, if you're currently pregnant, if you have children under the age of 2, or you have chronic conditions like asthma that would be exacerbated by the flu. Mm-hmm. So
And what about children? Same thing? You know, you said 6 months and up?
Yeah. Can't do babies under 6 months, but we can do those pregnant mamas that give them that initial protection until they are old enough to be vaccinated. So, you know, that flu vaccine prevents millions of hospitalizations and even deaths each year. People do die from the flu.
Now, and every year they do different strands, or am I saying that correctly with the vaccines for flu?
Yes, there are several different types of flu vaccines. So there is a flu vaccine for pretty much anybody. You know, if you have an age requirement, if you have a certain health status, if you have allergies to some of the components. Like I said, there's different types. But they study the flu every year, and they look at the strains they think are the most prevalent, and that's what's going to be in your vaccine. Some of them are bivalent, which means there's 2 strands that are covered, on up to quadrivalent, which means there's 4 strands that are covered. So personally, if you can, I would get the quadrivalent because that just gives you so much more protection. We're in peak vaccination time. September, October is the recommended time to get your vaccine, but flu season actually goes all the way through April. So, you know, anytime up through there. And, you know, the thing about COVID and flu vaccines, too, is there are people out there who can't be vaccinated for whatever reason. So all of us getting our vaccines gives them some protection, too.
Right. With those vaccines, where do they get them? At their clinics, their doctors, health department maybe?
So I'm going to talk about our vaccine program in just a second.
Okay. Hold on to that. Okay.
Health department is an option. Your physician's office, pharmacies do a lot of these routine vaccines, and that's an option to get you in and out faster.
Right.
So there's a lot of different ways to get vaccinated.
And the cost usually is, if you have health insurance, it's usually a preventative, so you get that at no cost.
Yeah,
or
typically any of these preventative vaccines are covered through your insurance.
Yeah. So that makes it excellent. Now, what else are we going to discuss with those vaccines?
So other vaccines folks need to think about this time of year are pneumonia. That one's recommended for children under 5, so that will be in those routine shots they get before they head into school, and adults 65 plus.
So do you not, if, I have had the pneumonia shot, but it was before COVID. So do I need, but I'm not 65 yet. So I should be okay, or is pneumonia on my list?
So you should be covered, but always if you have a question about whether you need a booster, talk to your doctor.
Gotcha.
They know your health the best, and they can give you that recommendation. So with pneumonia, the reason that 65 plus age group was selected for was recommended for this one is our senior adults are more at risk for severe disease, and you know, potentially pneumonia again could be fatal for that age group. So if you're in that age group, definitely want to get your pneumonia shot.
Well, and it presents, not that pneumonia turns into COVID, but my mother had gone into the hospital with pneumonia, but she also tested positive for COVID at that time, and we had no clue. Is that something, does that still occur now?
COVID affects a lot of body systems, actually. We think of it as a respiratory disease, but it also can affect the heart, the kidneys. I mean, it can affect all your major body systems. So it's not surprising that she did end up with a complication like pneumonia.
From those.
Yeah.
And again, it was age and other health issues.
Yeah. So if you're like me and you're in that 50-plus age group, shingles is another one that's recommended.
No one wants shingles.
Very painful. I've never had it, but from those who have, I've heard it's very painful and it can recur. So that one's a 2-dose series. They're usually about 6 months apart, but your doctor will tell you what your timeline will be. And honestly, the vaccine is the only way to prevent against the virus. So if you've had chickenpox, that virus is already in your body, get your shingles vaccination.
And again, what about having these vaccinations the same day?
All of the ones that we're going to talk about today can be co-administered.
Okay.
Now, Side effects wise, you may not want to do that. You may want to spread them apart, but it can be done. If you want to, do a one and done doctor's visit, you can do that.
Okay, all right.
If you've never heard of Tdap, that one covers tetanus, diphtheria, and pertussis. And pertussis is actually whooping cough, which most people have heard of. So your kids are going to get that one when they get their 6th grade shots. Mm-hmm. But it's also recommended for pregnant people in the 3rd trimester and for adults to get that booster every 10 years. And we usually think about the tetanus side of that one, get that tetanus every 10 years.
Right.
But talking about pertussis, it can be very serious for infants. It can actually be fatal for infants. So if you're a caregiver of an infant, so talking to all the grandparents and babysitters and that sort of thing here, get your Tdap if you're going to be around babies.
Okay.
And then another one that's really in the news is RSV.
Right.
It is also a virus. And your adults 75 plus is the recommendation for RSV. Pregnant people after 28 weeks should be vaccinated for RSV. And again, that gives babies some protection right after they're born. Mm-hmm. And adults 60 plus who are at an increased risk for complications from RSV.
Now, children, when they get whooping cough or those younger children that have RSV issues, they're usually sent home from school or daycares at that point. Are the adults that take care of those little ones at risk also? Or is it an age thing?
Well, these are respiratory viruses. They're usually airborne is how they're passed. So anybody in that immediate household is also at risk. But most of us with a healthy immune system, it's not going to be an issue like it would for a toddler or a senior adult.
Especially, because I hadn't heard of an adult within mid-range saying that they had whooping cough or whooping cough.
Probably because it was so minor, and they could have thought it was something else.
Gotcha.
And that was kind of my next point. It's often hard to distinguish flu from COVID from RSV unless you test. So you definitely want to visit your physician to find out, which virus it is so they know how to treat that. With RSV, like I said, our senior adults and our infants under 6 months are the ones who are especially vulnerable. They could end up hospitalized with RSV. And RSV can lead to even more severe illness like a bronchitis and pneumonia. So definitely want to find out what it is and treat it appropriately.
If they live in assisted living or what we traditionally call nursing homes, is that something that they can prevent in regards to the spreading of it?
So we found this out very well during the pandemic. Group living like that, viruses spread very easily. So you really have to use your precautions like staying away from other people if you're sick, using a face mask if that's appropriate, washing those hands frequently, covering those sneezes and coughs, and disposing of those tissues appropriately. All of those measures really worked during the COVID pandemic. We didn't see a flu season during the pandemic, so we know those measures work.
Yeah. So that same protocol that we started practicing needs to continue.
And I do see a lot of people who wear their masks out in public, so you know that they're trying to protect the people around them. So that's very much appreciated.
Exactly. Yeah.
So something exciting with the health department. Years ago, we used to offer vaccines to adults. We would do flu clinics and the like. Well, that is back. We are getting ready to launch our adult vaccine program. This week, we will launch adults flu. We're going to start with flu. Mm-hmm. And all of this is for anybody 19 or older, because if they're 18 and under, they would qualify for our Vaccines for Children program. So we'll be able to accept pretty much any insurance, Medicaid, Medicare, most private coverages. And there's about 15 different vaccines that we'll be able to offer. All the ones we just talked about, flu, COVID, pneumonia, shingles, Tdap. You can be seen at any of our 6 sites. You don't have to live in that county to be seen there.
Great. What about appointments?
You do need to call and make an appointment.
Or go online?
We don't do online scheduling for a reason. We want you to talk to a person.
Okay. Great.
Especially our senior adults, it can be really challenging to navigate that online scheduling, especially if you need more than one vaccine
Yes.
or you need more than one service. So we want you to connect you to an actual person. When you come to your appointment, you will need a form of ID and your insurance card. And like I said, we're going to start with flu, but watch our social media. We're on Facebook and Instagram. And if you have our app, we'll push it out that way when we'll start offering those other vaccines.
Yeah. And again, if they come in multiple vaccines, so right now, the ones that you read are available, but they have to...
They can go ahead and make an appointment.
Okay.
But initially, we're gonna start with flu because, like I said, this is a new system for us. We're gonna work out the bugs with one vaccine before we start offering the whole menu.
Everything else.
Yeah.
Okay, that's great. Not too long ago, actually, I guess it's been a few years, you all started like a teen section of your website and Facebook page. How is that going, and how do you try to drive those young adults to that site to get important information?
We do have a dedicated teen and young adult section on our website. We actually just redid our website, so it's actually new, fresh content, hopefully is much more user-friendly. They can get information about vaping, relationships, having a healthy body, self-esteem, all of those types of topics. We also have a school initiatives program that's part of our harm reduction program. Mm-hmm. So they're actually out in our middle and high schools talking to teenagers about, relationships, and making good decisions, sexual health, making choices about tobacco and other substances. So, we really want to take care of that generation.
Well, and so many of our FRISCs offer those workshops mm-hmm. through the health department, and we have been able to videotape a few of those,
awesome.
And so we share those on our channel, because I do think many times parents, not that they need to be helicopter parents, but if they see that information, they may see something that they didn't recognize before in regards to their children's maybe a behavior issue that started, or it's a little bit like backing away.
Yeah.
So it can also be very beneficial to parents and guardians as well, on the lookout for things.
And the curriculums that we use in the schools have a parent component because we want them involved. We want them to know what their kids are learning. So that is built into the curriculums.
And that also includes those grandparents raising grandkids too.
Absolutely.
In order to take care of that.
There is a huge portion of our population where those are the caregivers.
Yeah, exactly. It's been a while since we talked about it because we haven't had this chance. What about fentanyl and the issue that it's still prevalent, and what are some of those things that we need to be aware of and make people aware of? Because it's still a deadly disease, not a deadly overdose occurrence.
It is, and it's
highly addictive.
It's in so many substances. So the encouragement here is to have Narcan on hand. Narcan's just the brand name for the medication naloxone. And what it does is, if it's an opioid drug like fentanyl, it can reverse that overdose. So if you have someone in your life that uses substances, even if it's a substance you don't think could be an opioid, that fentanyl could be mixed into it. So have that Narcan on hand, know how to do CPR, and save that loved one if you have that chance.
I was going to say, it can happen at any age. Right.
Yeah.
With vaping, let's discuss quickly vaping and how prevalent that is. And, I think that initially young people thought, oh, well, vaping is safer than cigarettes. and it's not addictive, and I really like the thing that they make that makes it look cool.
Yeah, what really kicked off, and that is an epidemic as well,
Exactly.
was the flavors, because it came in so many youth-driven flavors. Actually, the numbers of youth using vapes has come down slightly, so I hope that is an ongoing trend.
Maybe more education that's come out about it, and these vaping companies being charged with...
There is more regulation of those, or attempted regulation. It's a lengthy process, but that probably has played a part in it. And you know, these things are cyclical, right? It was very popular, and now it's on the downhill trend. And I don't have an answer for what the next thing
I was going to
is.
say, hopefully not a new vice is coming up. But
once we know, we'll definitely, put out the word.
if individuals need additional information, I know during the COVID season, you would send them to, .gov, and your website, since it's just been redone. What types of information can people get in addition to the few things that we've mentioned?
So all of our services are on the website. There are also other links to partner agencies like the CDC, where you can get good, trusted health information. You always want to find a trusted source for your health information.
And anything that's on there has been vetted,
Correct.
Basically, and researched. And so it's not somebody writing an idea for their own purpose or whatever. So
yeah, don't go to social media for your health information. You definitely want to go to a trusted source. And just to plug our app, I'm the one that does the notifications and the pushes. So if something's going on, we've had drug alerts where there have been a high number of overdoses in one of our areas. We can push that out. If we have food recalls, we can push that out. Disaster awareness, any of those things we need our public to know about quickly, we can push that out through the app. So.
Okay, well, that's great. And how do they download the app? What do they look for in their app?
Just search Lincoln Trail District Health Department.
Okay.
It's totally free, both Android and Apple.
Yeah, and it's really important to get that out there too. When COVID hit, there were some things, of course, you all had to suspend some services. And I believe when we talked last, you were able to finally see patients could come in for pregnancy and things like that, where you could do well baby care in the womb.
We do see those pregnant mamas mostly through our WIC program, which provides nutrition and breastfeeding education, and through our HANDS program, which is parenting assistance. So yes, our clinics are fully open. If we haven't already added back every service we used to do, we're in the process of it. So pretty much anything you used to be able to do through our clinics, you can do again in person.
Awesome. And you had mentioned, and I don't know if it's something that you can share, but there are available positions at the health department?
Absolutely. We are hiring. We have some interesting positions to fill. We're always going to need our public health nurses and our environmentalists, but we also need somebody who likes to work in policy development. We need somebody to work in health equity, because equity is at the center of everything we do in public health. I'm trying to think of some of the others that we have open. People to work in our HANDS program, with those new parents. So just get on our website, ltdhd.org, and go to the careers page. You can actually apply for any of our jobs from our website or even from the app.
And how is the little lion doing? You have a mascot, so
We do.
Let's share that. And sometimes, has he been able to participate in some festivals or fairs?
We actually have one on Saturday. We have 2 more next Saturday, so this is festival season, so you'll definitely see Lincoln the Lion out and about.
Okay, so he's added to your all's little, in addition to the great people that go out, he's out there celebrating too.
Yeah. His motto for kids is to be safe and strong.
Safe and strong. Well, thank you again, Melissa. Again, phone numbers or websites you'd like to drive people to?
So website is ltdhd.org. You can reach us at our central office, and then we can direct you out to whatever service you need at 270-769-1601.
Okay, great. And anything that I didn't allow you to touch on that you need to mention? Think we're good?
I think we're good.
Okay. Thank you all for joining us today. And again, look into Lincoln Trail District Health Department at the services they provide to make yourself a healthier and informed person in our community.